Research is showing more and more that cerebrospinal fluid flow, or CSF flow, is a crucial function and that inhibition of this flow is associated with neurodegenerative conditions like multiple sclerosis and Parkinson's disease. I'll be giving an overview and summary of a great paper with tremendous detail of CSF health on this episode of the Upper Cervical Chiropractic Research Show. I've also done a discussion video with Dr. Tyler Evans. You can find that video on this YouTube channel. Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive Podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. These research reviews, interviews, and episodes are made for you, whether you're a medical doctor, patient, or concerned family member or friend. The goal of these shows is to bring awareness of the importance of taking care of our spine and the impact it has on our health and the hundreds of different health conditions it could cause without us realizing it. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support. Now on to the show. Hey everyone, welcome back to the Chiropractic Deep Dive Podcast. I'm Dr. Kevin Leach, and this is episode number 8 of the Upper Cervical Chiropractic Research Show. This episode's research review is titled Cerebrospinal Fluid Stasis and Clinical Significance by James Whedon and Donald Glassey, published in Alternative Therapy Health Medicine. The link to get this research is in the description below. It's always recommended to get the research and read it yourself, as there are far more details in the paper than I can include here. The problem the paper is attempting to address is helping those with neurodegenerative conditions by creating awareness that cerebrospinal fluid flow most likely has a significant contribution to these conditions. This paper reviews the purpose and function of CSF and what can happen when CSF flow is obstructed. I'm going to read the abstract for you, and then we'll get into some details. We hypothesize that stasis of the cerebrospinal fluid, CSF, occurs commonly and is detrimental to health. Physiologic factors affecting the normal circulation of CSF include cardiovascular, respiratory, and vasomotor influences. The CSF maintains the electrolytic environment of the central nervous system, influences systemic acid-base balance, serves as a medium for the supply of nutrients to neuronal and glial cells, functions as a lymphatic system for the CNS by removing the waste products of cellular metabolism, and transport hormones, neurotransmitters, releasing factors, and other neuropeptides throughout the CNS. Physiologic impotence or cessation of CSF flow may occur commonly in the absence of degenerative changes or pathology and may compromise the normal physiologic functions of the CSF. CSF appears to be particularly prone to stasis within the spinal canal. CSF stasis may be associated with adverse mechanical cord tension, vertebral subluxation syndrome, reduced cranial rhythmic impulse, and restricted respiratory function. Increased sympathetic tone, facilitated spinal segments, dural tension, and decreased CSF flow have been described as closely related aspects of an overall pattern of structural and energetic dysfunction in the axial skeleton and CNS. Therapies directed at affecting CSF flow include osteopathic care, especially cranial manipulation, craniosacral therapy, chiropractic adjustment of the spine and cranium, network care, formerly network chiropractic, massage therapy including lymphatic drainage techniques, yoga, therapeutic breathwork, and cerebrospinal fluid technique. Further investigation into the nature and causation of CSF stasis, its potential effects on human health, and effective therapies for its correction is warranted. Let's just review some basics of cerebrospinal fluid, which I'll refer to as CSF. CSF is a watery fluid found essentially between the brain and spinal cord and the skull and vertebral canal created by the spinal bones. 3 factors affect the CSF flow. They are cardiovascular, respiratory, and vasomotor, meaning blood vessels. In 1927, Dr. Cushing described the CSF as the third circulation, the blood and lymphatic systems being the first 2. Important functions of the CSF include maintaining electrolyte balance of the nervous system, influence acid-base balance of the body, bringing nutrients to the brain and spinal cord, taking away waste products from the normal cell metabolisms, and transporting hormones, neurotransmitters, and other neurochemicals throughout the central nervous system. Interruption and cessation of the CSF not only happens with degeneration and pathology of the spine, but also with biomechanical misalignments of the craniocervical junction, which is the relationship between the skull and the top 2 bones in your neck. The paper gives a great, concise review on the details of CSF in volume, production, pathways, where it's produced, etc. on page 2. You can read these details on your own. Alexander Munroe proposed that the cranium was a rigid box, per se, filled with CNS tissue, blood, and CSF, and that any increase in any of them would increase the intracranial pressure. This was called the Munroe-Kelly Doctrine and was revolutionary for its time. The only aspect that has been challenged and remains controversial is that many believe that the cranial sutures do not ossify and thus have an elastic characteristic which can adapt to change in intracranial pressure. 2 authors also hypothesized that the cranial sutures possess a stretch-like reflex that triggers CSF secretion. CSF circulation is somewhat of a misnomer as it doesn't have a leaving and returning point like the blood does from the heart. It has secretion areas and absorption areas. It has a general start and end point, but in no means like water flowing down a river. It can sometimes have backflow and can have stasis or lack of movement, which is what this paper is investigating. What happens when there is stasis of the CSF? Let's review the cardiovascular influences on CSF. Sutherland in 1939 correctly predicted that there were rhythmic movements of the brain that correlated to the pulse waves of the CSF. However, he proposed a mechanism of which there were spontaneous brain pulsations pumping the CSF, where we know now that the pulse waves are associated with the systolic cardiovascular pressure. The systolic pulse wave is well established as the primary mover of CSF. The flow direction of the CSF in the spinal cord during systole is downward, or caudal, while during diastole there's a recoil that changes the direction cephalad or back up to the brain. During systolic arterial expansion, the midbrain and brainstem extend caudally, acting like a piston, forcing CSF down into the spinal cord. Now let's review the respiratory effects on CSF. A recent study cited in this research paper suggests that respiration may be just as important as the cardiovascular component for CSF flow. The respiration drives a low-frequency oscillation of the brainstem, again like a piston, where expiration drives the brainstem downward and inspiration drives the brainstem upward. The more forceful the respiration, the more pronounced the movement of the brainstem. Just as a side note and a thought of mine while reading this paper is that there's lots of evidence that breathing and breath work is highly beneficial, and I believe it's mostly believed to be from oxygen, but as respiration is clearly identified as having a role with CSF movement, it would imply that another mechanism besides bringing oxygen to your system while doing breath work. It's also pumping CSF and clearing out any stasis that may be present. Modified breathing efforts like Valsalva's maneuver, which is a bearing down, and coughing also affect CSF flow. And finally, let's move on to the third mechanism of CSF flow, the vasomotor influence. These are the spontaneous pulsations of arteries, veins, and lymphatic vessels. These vasomotor waves are called Traub-Herring-Myers waves, or THM waves. THM waves, along with heart rate variability together, are shown to be indicative of good autonomic nervous system function. The waves that the THM waves make in the CSF are called C waves, with a frequency of about 4 to 8 per minute. Let's move on to the clinical significance of CSF stasis. Well-known medical issues associated with CSF flow problems are conditions like hydrocephalus, intracranial hypertension and hypotension, and syringomyelia. Research also suggests that stasis of the CSF associated with neurodegenerative conditions. A multitude of causes can contribute to poor CSF function, which includes space-occupying lesions, subarachnoid cysts, reduction in CSF production due to age-related pathology of the cardiovascular and cerebrovascular circulation, calcification of the choroid plexus, and decreased brain tissue compliance. A medical doctor, Dr. Edward Rubenstein, wrote in The Lancet, a medical journal, in 1998, how CSF could be a contributing factor for some forms of dementia, which are neurodegenerative in nature. CSF stasis and its ill effects have been discussed by many, including Rubenstein, Perrin, Sutherland, Upledger, Epstein. It may be possible for trained doctors of chiropractic and osteopathy, craniosacral therapists, massage therapists, yoga, breathwork, and other techniques to address CSF stasis. We've done an episode on how the craniocervical junction can be misaligned and affect the craniocervical hydrodynamics previously, and we'll be reviewing another paper very soon. There was a small amount of research on using different techniques to reduce CSF stasis. However, this paper being published in 2009, there's much more now than there was then. For a detailed approach of all techniques and treatments aimed at removing or reducing CSF stasis, see the paper itself. In conclusion, evidence exists that suggests that there can be presence of CSF stasis without the presence of pathology or symptoms, yet still have negative systemic effects. CSF stasis may be associated with mechanical cord tension, chiropractic subluxation, reduced cranial rhythmic impulse, and restricted respiratory function. When it's said to be associated with, it means that the research has found an association, but not necessarily a causation. Techniques and therapies exist to address CSF stasis. At the time of this research's publishing, the mechanism of action wasn't quite proven or understood, but more research has come out since then on this topic. Even so, more research should be done to investigate more about CSF stasis and its negative effects on human health and healthcare approaches that can be used to prevent and treat CSF stasis. In summary, there's more and more evidence that CSF stasis has negative and often detrimental effects on the body, a slow process over time that can cause significant health issues. More awareness of this evidence needs to be disseminated to providers everywhere. Being an upper cervical chiropractor, practicing NUCCA, my role here is fixing chiropractic subluxations of the craniocervical junction, precisely where CSF can be obstructed manually. As a profession, chiropractic has traditionally and still does believe that we work with the nervous system, specifically the neuromusculoskeletal system, though more and more evidence suggests that we are actually affecting much more than that with reducing CSF flow stasis. Okay, that's it for this episode. So what did you learn that fascinated you or surprised you about the research today? Join or start the conversation in the comments below. Hey, thanks so much for watching. To watch more of our research shows, click or tap the screen right there. To subscribe to the channel, click or tap the screen right there. Until next time, I'm Dr. Kevin Leach with the Upper Cervical Chiropractic Research Show, bringing awareness to conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic. Until next time, take care and take care of your spine. It's the only one you'll ever have.